Welcome back to the channel. Hepa filters don't work in kindergarten classrooms. The latest paper is out from the German group. Let me read you the title: The Effect of Portable Hepa Filters on COVID-19 Period Prevalence, an Observational Quasi-Experimental Study in German Kindergartens. What do you need to know? This comes out in BMJ Open, and it's an important paper. It's not quite a randomized control trial, but it's pretty good. It's a quasi-experimental prospective study, and we're going to talk about its implications. But first, let me tell you, when the COVID-19 pandemic hit, there were a lot of people who had done work on ventilations in buildings. They had been studying the sick building syndrome. They'd been studying respiratory viruses in buildings. Those people came out foremost and said the solution to the COVID-19 pandemic is that every building get a $100,000 or multi-million ventilation upgrade, that we need brand new HEPA filtration systems in all of these buildings, particularly schools, and they go around preaching that message. Some of them have direct financial conflicts of interest. They make money the more we actually convert buildings. When you're a school, you have a choice with all the money you have. One choice is, do you spend it on the students? Do you spend it on the teachers? Do you spend it on education? Do you spend it on nutrition? Or do you spend it on these gargantuan HEPA filters? Which one do you spend it on? And that choice needs to be based on evidence, because we need to take the dollars, the limited resources we put into children's education, and make sure children get the most benefit from that, not the manufacturers of ventilation systems. So I was always someone who, during the pandemic, said, you can't assume that merely because the ventilation system catches the particles or reduces the viral load in the air that it will actually reduce infections. You need to directly interrogate that hypothesis. And that reasons it might not, we'll talk about in this paper, because it turns out it doesn't. But you need to actually test the question by having and turning on the HEPA filter. Do you have better outcomes than if you don't have it or don't turn it on? Now, I've always suggested the best way to do this is a simple sham-controlled study where you actually just randomize people to the HEPA filter or a box that just makes noise and see how many infections they have. In the absence of that kind of cluster randomized design, we get the next best thing, which is the German group. Here's what they did. They took German kindergartens, and German kindergartens are a little bit different than the U.S. They take kids between the ages of 1 and 6, so it's more like a preschool setting. And they picked several kindergartens in which they were going to deploy 10 institutions, the HEPA filtration system. 35 groups of children were exposed to HEPA filtration systems in 10 institutions. That's 663 children and 147 caretakers. Then they found 22 control institutions, places that were very similar to the places that have the HEPA filtration system installed, but they didn't. These were 65 groups of children and something like 1,600 kids and 370 caretakers. So they get a nice prospective cohort, 2 prospective cohorts, and they're going to follow them out into the future. They deploy the systems in about 2021, so this mostly pertains to Omicron, which is actually quite relevant because that's what we're dealing with now. And they follow how many kids and how many caregivers get COVID-19 over the next period of time in what they call period prevalence. One of the most interesting things here is that COVID-19, how is it being documented? It's being documented by self-reports. But in Germany, they say there is a good concerted effort to report if your child has COVID-19 to the central authorities, and it gets logged online in a database, and that's how they're using the endpoint. But more importantly, even if one hypothesizes that not everyone's going to report every case, even if one hypothesizes that some cases are going to be missed, there's no reason to think those are going to disproportionately occur in the arm that got HEPA filters versus the arm that didn't, or vice versa. There's no reason why that error rate is going to be any different in these 2 cohorts, and I think that's one of the virtues of this study. So they also talked about the other things they were doing. Well, of course, they were scrubbing down surfaces, and they had kids wear, masks. They talk about in their own paper that for a child under the age of 6, it's very difficult to get them to comply with wearing a mask, and they thought it was quite foolish. And in fact, actually, the majority of schools in Germany did not actually enforce masking in the classroom. Some places had cohorting where the kids were separated, and in those places, at some times when they walked in the hall, they had to wear a mask. So they had all sorts of different rules. But again, there's no fundamental difference, I think, between those 2 groups in terms of ventilation frequency. Now, the rooms that weren't getting HEPA filters, of course, the people may have opened the windows and doors a little bit more often and got a breeze through there. But that's natural. That's what happens in a world where you don't have a HEPA filtration system. So the question is, does the HEPA filter improve outcomes beyond a very reasonable thing, cracking open the window or something like that? So there are some differences there, but I think they're not really germane. And what do they find overall? I'm going to show the figure on the screen right here. I'm going to show that figure. And that figure is going to be the period prevalence cases per 1,000 children in the intervention and control arm. And you can see there's a red area and a blue area. And the red area, ironically, are the group who got the Hepa filters. It's actually a little bit numerically higher. And the blue group is the group that didn't. It's numerically lower, but there's actually no statistical difference in terms of the number of kids who got COVID-19 or the number of adults who got COVID-19. Most notably, in my mind, it's actually maybe about 1 in 3 kids are getting COVID-19. We're getting period prevalence around 300, 330 out of 1,000. In other words, most kids are going to get COVID-19. You know, it's a circulating respiratory virus. It can't really be stopped. What else do I want to say about this before I get to my conclusions? I guess the last line of the paper I think is crazy. Classic preventive measures such as wearing a face mask and frequent ventilation remain of utmost importance. The authors did not verify that fact in their study, and that's speculatory, and there's no evidence to support that. I suspect they wrote that just to sate the peer reviewer. But I think the key point is, in this study, the COVID period prevalence of children in German kindergartens was compared between kindergartens with HEPA filters and without HEPA filters, and during the Omicron wave. We hypothesized HEPA filters will have a preventive effect, but they absolutely didn't. The hypothesis was rejected. Oh, one more thing I wanted to tell you. The brand of HEPA filter used, they use something crazy. Here's what they say. The DEMA AirTech system uses a coarse pre-filter, HEPA H13 filter, activated carbon filter, plasma, titanium dioxide photocatalyst filter, and ultraviolet C light in this order of configuration. It's got a lot of stuff in that HEPA filter, and that stuff is practically useless. Okay, so you can spend all this money on kids' schools and you can install all these HEPA filters, but practically it's completely useless. The kids have the exact same rate getting COVID-19 as if you didn't do it. It's a waste of money. The people who've been selling this idea have not been relying on this level of evidence. You could do better than this level of evidence. You could get cluster randomized trial evidence, but they're relying on lower levels of evidence. They're not testing the claim in the real world. The claim is not, if you have a HEPA filter and you spritz a bottle of aerosol, how quickly does it suck up the aerosol? That's not the claim. The claim is, in the real world, as you use it, kids will get sick less often. Now, some people might say, well, the kids are getting sick at home. HEPA filter, they don't have it at home too. Well, that's the problem of your intervention. What's the point of having your intervention being done at school if they're just going to get equally sick at home? Your intervention is literally making no difference in the background of their life. Ergo, your intervention has failed. That's the definition of a failed intervention. The authors of this paper actually speculate, well, the kids got COVID-19 anyway in the classroom, and they say the reason is kids play so closely together. They're so close together that a HEPA filter at some distance is not going to stop the immediate spread of respiratory virus between one and the other. That's also entirely plausible. But whatever the mechanism, this study undermines the claim that these expensive HEPA filters have any utility. And I think the people pushing this are doing a grave disservice. They have an obligation to show in cluster randomized fashion that if you randomize places to having this or not, or turning it on or not turning it on, that there is an improvement in health outcomes over the next 30 or 50 or 60 days. What is that improvement in health outcomes? Are we less likely to get all colds? Are you better at work? Do you have more productive? Whatever you make your claim, look at some outcomes and show me in a randomized fashion. I think the takeaway message of this is, if one thinks back about the pandemic, that, maybe early on in the pandemic, before adult vaccination, you might have made the case that HEPA filters had utility if they could prevent kids from spreading it to their parents. So you might have wanted to see a cluster randomized control trial of HEPA filters to show that they're less likely to spread it to parents and there'll be some health outcomes improved for parents early in the pandemic. But once you had adult vaccination, I'm not even sure it makes sense. The vast majority of the kids on this globe have never been vaccinated for COVID-19. The vast majority of kids in this globe have never been boosted for COVID-19. The vast majority of kids in this globe have had COVID-19. They caught it, and the vast majority have done just fine. Nothing we did stopped that. They were going to do that anyway. And now that they've gotten it and they've gotten over it, does it really make sense to have these HEPA filters? You have to prove it. Prove that they're less likely to get respiratory viruses in the fall season. And more importantly, prove that they're actually better off as a result. Because getting some respiratory viruses, I hate to break it to people, that's an inevitable part of life. We actually don't know what happens to someone if they never get exposed to these viruses. If you never get any respiratory viruses in your life, do you live a long and healthy life? Or might something else happen to you? Who knows? We don't know what a world without respiratory viruses is like. It's so fundamentally unnatural. And the people chasing that vision are chasing a figment of their imagination. They're chasing some utopia. But even if you were chasing that utopia, this thing doesn't get you there. It's a completely failed intervention. So in my mind, I think This is so far the best study on HEPA filtration. It's better than the garbage that's been generated. The people who promote this, including esteemed researchers at Harvard and other top universities, they are being misleading. They're relying on low levels of evidence, and they're not pursuing the highest levels of evidence. I think many companies are caving to consultants who are talking about their ventilation. I would be very cautious about spending your limited resources in a company on improving ventilation when there's so many other things you might want to do with that money in the company. I think this is a damning study. The last thing I'd say is, when you start having titanium dioxide and UVC, might we want to also be looking at some low-level air pollutants that might be emitted from this process? I think that's also a salient concern. If these HEPA filters, in fact, even have a downside. We didn't talk about staph, but surprise, surprise, the staph, there's absolutely no difference in COVID-19 outcomes. And a very high percentage of staff have had reported COVID-19, which might be the reality of the world, which is that most people have gotten COVID-19, especially the Omicron. It's almost unstoppable. We're all going to get it. It's now a cold and flu-like illness. So I disagree with that final sentence. I think otherwise it's pretty well-written paper. I think they actually do a good job of walking you through their thinking. I think this is so far the best. It's not perfect. Don't get me wrong. It's not a cluster randomized controlled trial. It's not able to disambiguate if the HEPA filter, not having the HEPA filter is having compensatory behavior changes. But the authors, I think, make a fair argument that if you don't have the HEPA filter and you do other things differently, and those other things work as well as the HEPA filter, then you don't need the HEPA filter. That's also a fair argument to make. A perfect study might be cluster randomized design, many classrooms, where you randomize them to ventilation, you randomize them to a sham ventilator, you just turn it off or it just makes a humming sound, and you randomize them to no ventilation. And then you follow a range of health outcomes, including respiratory outcomes, how well they perform in tasks, how well they're doing in school. And then you actually look at the cost effectiveness, whether or not that money would rather be better spent on serving them some better, more nutritious lunches. My intuition is that every dollar spent on this was a waste of money, and that it would be much better spent on nutrition and providing more reliable after-hours care and some basic stuff that, schools already do a bad job of, particularly in this country. In terms of masking young kids, the one good thing in Germany is the majority of young kids were never masked. That's because their country is not run by very poor level thinkers at the CDC and AAP who took masking down to 2 years old with no credible evidence, severely undermining their credibility for all things to come. So those are my thoughts on the paper, Effective Portable HEPA Filters on COVID-19 Period Prevalence and Observational Quasi-Interventional Study in German Kindergartens. If you like this and you like research appraised like this, follow this channel, subscribe now, push that button for notifications. Follow me on Instagram. I'm now on Instagram. I'm going to put that up on the screen, and you can DM me there. And follow me on Twitter. I run the Substack Vinay Prasad's Observations and Thoughts, and I also write for Sensible Medicine. So until next time.